Hello, my name is Linnea Anderson-Geither, and this is the school presentation for ISHA PD series. And with me is Diane Barnes-McGuire.
Hi, Lene. Thanks for having me join you today. Lene and I are the co-chairs of the School Affairs Committee.
Yes, we volunteer for the School Affairs Committee. That is our non-financial disclosure, and I have no financial disclosures to share at this time.
I will just add additionally that I am an adjunct professor at Lewis University, for which I do receive a stipend, and I am currently a building principal in a large special education cooperative for which I receive a salary. Some of the information that you are going to see in our presentation today is information that I have shared with our employees at both locations.
So today's agenda, we will go over certification, licensure, and maintaining your credentials for school support personnel, speech pathologists, an overview of working in schools, FAPE, missed sessions, and compensatory services, some goal setting ideas, some parent trainings, going over shortages. We all know there's shortages in our field, and some other legislation that may be upcoming in the near future.
One of the really important points that we wanted to make sure that we reinforced in our presentation is the process of gaining certification in the state of Illinois, gaining licensure, and being able to maintain your credentials so that once you start working, you don't have to stop working. You want to ensure that your credentials that you have worked so hard for never lapse. So the first piece of information we want to cover here is the all-important Illinois Department of Financial and Professional Regulation license, IDFPR licenses all speech language pathologists, all audiologists, and speech language pathology assistants in the state of Illinois. In order for you to work in a professional setting, you must have applied for your IDFPR license. When we talk about working in the school system, we add the complexity of the Illinois State Board of Education, ISB, Professional Education Licensure, the PEL. Your PEL can be either teaching or non-teaching. A third piece of information that's very important to speech language pathologists and audiologists, as well as SLPAs, is the early intervention certification. While working in the schools in the state of Illinois, it is not required of you to have the early intervention certificate. However, some school districts desire that you hold this credential, especially if you're working in the school district's 0 to 5 early childhood or family enrichment program, because your clients, your students at this point could be as young as 0 and can continue in the program through the age of 5 if they meet certain criteria. And so you might be an overlapping employee who might be working with the 0 to 3 population at the same time that you're working with a 3 to 5-year-old population in your school district. And depending upon how rural your school district is, your district may ask or entertain that you receive that EI certificate to help gain intervention earlier for children in that area, because we all know that the earlier we intervene as speech language pathologists and audiologists and assistants, the better the prognosis for the student.
All right, so to be able to receive your IDFPR license, you'll have to fill out the IDFPR application for an initial license. And every 2 years, we do refill out information to maintain that IDFPR. And you must be able to prove your continuing education in order to obtain a renewal of your license. Diane, do you remember what the number is for that 2-year period?
I know that the month that we renew for speech language pathologists is October. So by October 31st, every 2 years, it has to be renewed, but I don't remember our actual code number as an
I'm
SLP.
just wondering, I follow ASHA's certification requirements. And if I follow ASHA certification requirements, I'm covered. My IDFPR certification requirements are also covered. So
yes, I absolutely understand your question now. And so that is 20 hours every year for your ISB. And for the IDFPR, I believe it's also 20 because it's consistent.
okay. And then if you choose to work in schools, you apply for your professional educator license. And you must prove you have completed the program from an accredited university. You have to pass the praxis. And you can obtain a Pell while you're waiting for your ASHA Cs. I have had clinical fellows that I've supervised. Diane, I'm sure you have as well within the school system. It is not uncommon for a CF to join our teams. And usually they do quite well.
They do quite well. And we wholeheartedly embrace clinical fellows in the school setting. I know that sometimes it can be difficult to obtain a clinical fellow position in a medical setting or a SNF setting or hospital. Sometimes you have to work really hard to piece things together to get a full-time position within those settings. And one of the beauties of being in the school setting is that most school years run 9 to 10 months. So if you start at the beginning of a school year in your clinical fellowship year, you would be able to have your supervisor supervise you throughout the year. And at the completion of that school year, you would have worked enough to be able to apply for your full ASHA Cs.
And I know administrators don't always realize that we have to have this ASHA certification, but coordinating with your local co-op, I know our co-op has supervised as well, just depends on how your district operates.
And one of the things that you might want to do is when you're interviewing for your position, make sure that you ask that question. Is there someone on staff who could do my clinical year supervision? And if you're having trouble articulating what that involves, you can certainly reach out to Linnea or I, and we can help provide you with some materials for you, as well as ASHA can provide you materials for you to be able to have a conversation with the supervisor that you've interviewed with.
Absolutely.
Early intervention certification is different and separate. In order to gain your early intervention certification, you do have to meet all of the requirements in order to hold your ASHA Cs as well as your IDFPR license. This is additional. You must enroll in IMPACT as an early intervention provider. You have to engage in monthly meetings in order to maintain your early intervention certification. You have to accrue continuing professional development hours in early intervention topics in order to maintain your early intervention certificate. And a lot of people aren't aware when they first start looking into early intervention, there are 2 certificates within early intervention when it comes to a speech language pathologist. The first is for a therapist. The second is the evaluator certification. So those are 2 separate certifications. So we know that sometimes those clinicians working in the school setting like to supplement their income. And so when you first start out and go into the early intervention system, you would only be eligible as a therapist. And then once you have worked for a period of time and done re-evaluations, you can apply to become an evaluator within early intervention. And we have shared the links for all of these. The links that you're seeing on our slides at this time are the current links at the time of us recording our session.
All right, so here we're going to discuss an overview of working in a school setting. Most speech language pathologists or audiologists in schools are members of the school support team and are school support personnel. When you're looking for jobs on the job bank, that's usually what we're classified under. We are usually, not always, part of the union and must abide by the bargaining agreement, which has been agreed upon by the school district and the union which you belong to. You are a part of TRS, which is the teacher retirement system, and you work on behalf of the students, and you're intending to help the students close the gap between their current levels and their expected age levels. And one part I always like to say is you're an advocate for the students and their families. So those meetings are hard. It is hard to be on the other side of that table. And being someone who is an advocate for that student is always nice to have at that table. And you more often than not will probably be a case manager for some, if not most of your students. And then other students will be case managed by somebody else in that district, whether it's a special ed teacher or director of special ed.
And that brings up a really important point when you know, if you're starting out in your career or your mid-career and you're looking for a possible different placement, is to be aware of the number of students that you might be case managing. Certainly if you are in a general education building and setting, you will more often be the case manager for your students. If you work in a special education cooperative, dependent upon where that cooperative is placed in the state of Illinois, you may case manage much less than if you just worked for a district.
Every building and every district and everything works a little differently everywhere. And it just comes down to figuring out what your building is doing.
One of the keys of being a successful speech language pathology assistant, audiologist in the school system, or a speech language pathologist in the school system is knowing that you're a member of a team. You are absolutely a team member who is working to support students' development of necessary skills across their lifespan. And so working in this profession, you're going to be on a lot of cross-disciplinary teams. And this really does help you better understand the strengths and needs of the students that you're working on behalf of. And as we said earlier, we are all working together in order to close the gap in skills, which certainly means that you're going to be collaborating, and you should expect to collaborate with classroom teachers, psychologists, social workers, occupational or physical therapists, behavioral therapists. And in addition to this, when you work with more complex students who might be medically fragile, you might be working hand in hand with a one-on-one nurse or a building nurse. You might be working with a vision itinerant. You might be working with the assistive technologist, if your district is fortunate enough to have the services of an assistive technologist, to help meet the needs of the students in your program.
Absolutely. And I know sometimes our jobs can feel a little island-like, but remember being part of this team, just because you might be the only speech path on that team, but it's all part of a team, and you're not truly an island, no matter how much sometimes it feels like that. The team is there for you.
And if you do find that you are the only speech language pathologist within your building or program or district, please know that through the Illinois Speech Hearing Association, there are district representatives. So the state of Illinois is split up into different districts, and you have a group, an area group that meets within these different districts of the state. And so you can find what area group you might belong to on the ISHA website. And most of these area groups hold meetings throughout the school year for you to be able to get some of your very specific speech language pathology or audiology continuing education hours. And then sometimes they band together in order to bring in big name speakers to come in and consult and work within different districts.
Okay, so within leadership of a school, we do have a unique placement where we're not a classroom teacher. I'm kind of, at least in my building, I'm kind of one of the frequent flyers when it comes to responding to crises. I know the children very well, and we're very well trained in de-escalation techniques throughout our education. And so we have a lot of skills and knowledge that we don't always realize we know. But those explicit trainings in language development and articulation do help in a lot of those areas, as well as helping lead small groups of adults to learn more about how they can best support their students. And we also know how to help prevent some of these communication disorders through the MTSS system, the multi-tiered system of supports, especially when you're looking at articulation delays of those later developing sounds, or language delays that may not pop up till they're older. So.
And one of the other ways, that we didn't necessarily post here on this on the slide, is that you can often find yourself in a coaching role. You can help coach classroom staff, whether it be one-on-one instructional attendants, paraprofessionals, new teachers, or new therapists who have joined in different roles within your school setting. And you can find yourself in the role of helping coach them to understand the unique aspects of speech and language, and how to apply that to helping the student develop skills. You might be coaching people on how to collect data, so that when they come to an MTSS meeting, they can come in and have a valid discussion about what they're seeing, what interventions they have tried in the meantime, and the results of that. Are things moving in a positive trend, or are they seeing more difficulty for the student? And you would certainly be in a position to help coach in that area. Sometimes I have heard of SLPs being asked to become comprehension coaches. So not reading coaches, not a math coach, but more of a comprehension coach or a executive skills coach, for programs where they have a lot of students who have attention deficit or traumatic brain injuries, and they kind of take the lead in helping co-teach classes or co-teach groups in developing these skills with the students.
I've helped coach my K2 end on phonemic awareness, because that is a big one in reading, and it's something that we are uniquely qualified to help with.
Mm-hmm.
All right.
Okay. We know that prevention and intervention fall in our scope of practice as speech language pathologists, audiologists, and SLP assistants. And one of the things that we need to remember as we go through our daily life of working in the schools is that the schedule that we present at the beginning of the year certainly should not look like the schedule we have as we come to the close of a school year. Because
if it gives you any idea, I'm on number 52.
Yeah, definitely. Schedules should be changing, if not weekly, every other week. And you might have to vary the type of schedule that you do. Some districts have more of a model with 3-to-1. Others have pulsing schedules, and other districts have block schedules, where they schedule events. You schedule your students, you schedule events that have to happen in order to ensure that there is a balance. So if you're coming through a very heavy IEP season, some of your minutes might get allocated a little bit differently, where you're not necessarily having large groups for large periods of time. You might be pulsing and seeing kids or students, 5 minutes here, 5 minutes here, so that over the course of the week, you're still getting your time in with the student, with some very targeted practice in certain areas. Some parts of the year call for you shadowing your student in order to see if they're able to transfer the skills from one setting to another setting. And certainly within the school year, you'll spend some time screening and you'll spend some time on response to intervention. And this is often a question about, do these students count on my caseload? No, they don't have an IEP. You don't count them as a caseload, but they are part of your workload. And so when we talk about scheduling events, those are some events, screenings, and time that you spend on response to intervention. That needs to be a scheduled event within your various different schedules that you might have, as well as time for evaluation and evaluation writing. Dependent upon the number of students that you have within your workload, that kind of tells you how much time you're going to have to allocate for pulling your materials together in order to present evaluation. Okay, now we're back.
Yeah.
Technological glitches. It's all okay. It's okay. And things happen. And we're all good. So let's go ahead.
All right. So supervision opportunities in the school setting. We do have numerous opportunities to supervise on different levels. You can mentor, like we discussed earlier, with a classroom teacher or even another SLP in your district if they are new to your district. If you have a new clinical fellow joining your team, you can be a mentor for them. Being a student clinician supervisor and a CF supervisor does require some additional continuing ed, which is outlined on the ISHA website. I believe it's 1 hour of supervision training. You can also provide supervision for SLPAs or pre-observation hours, which I believe is something similar to like undergrad students. Am I correct?
Usually undergrad, but there are some who still need some of those pre-observation hours as they start their master's degrees, dependent upon what state their undergrad was issued in.
Okay.
Okay.
All right.
So FAPE really drives and is kind of the bottom line of what we do when we're working with students who have IEPs. The reason that a child has an individualized education plan is to ensure that they are receiving a free and appropriate public education. And so your IEP that you work so hard to document everything into really has to include identified needs, present levels of performance, and this is the vehicle that is going to drive the determination of what is an appropriate service, what is an appropriate support for the student. And so when you are creating your IEP pages, the pages that you are contributing to, you need to ensure that you have explicitly stated what accommodations and modifications are going to occur. You have to list what that child's current level of performance is. If the child has autism, you must list autism supports. That page has to be present in their IEP. And these it help paint the picture of the level of support that the child needs and where that child is currently functioning in comparison to peers.
I always think of an IEP when I'm writing it. If there is anything that if somebody else were to take that IEP and read it, I want them to know exactly who that kiddo is. I may not be here next year. That child might move out of the blue. I want them to be able to look at it and go, I know exactly what I'm doing. I know exactly who this kid is.
That's right. And that is for every IEP that you participate in. If you have the most accurate information there, as the child moves from one district or one building to another, you pick up that IEP and you should be able to pick up where the last therapist left off. And when we talk about moving forward and moving, the IEP that you're calculating is intended to ensure that that child is going to make meaningful progress in order to meet state standards or essential elements with the stated supports that you have written. And one of the key things that was put into legislation a couple of years ago is that parents have always been an equal member of the IEP team. However, in order to participate equally, they need to receive your documentation in advance of the meeting. And so at a bare minimum, you need to give a draft report if you're in the middle of an evaluation, and draft goals that clearly state current levels of performance, and draft accommodations at least 3 days in advance of the meeting. And that's 3 school days. Okay. So 3 school days before the child is having their meeting, the parents must have those in hand. In some cases, especially with new legislation that was passed this February, you must provide them 5 to 10 days in advance. If you are in a school district where it is known that parents will perhaps be having legal advice, or lawyers are coming to the meeting, or certainly if there's a mediator involved, you will have to maintain and produce documentation 5 to 10 days in advance to ensure that your school district legal counsel can view what you're thinking, and then that parent is going to be sharing your information with their legal counsel. Also, if there's interpretation involved, your reports have to be interpreted in the language of the parent. If the parent has one of the 10 most common alternative languages in the state of Illinois, ISB just put this out in February. There's a list of the 10 most common languages often spoken by parents of students. If the parents of one of your clients' students speaks that language, you have to get it to an interpreter. And so that means that your report might have to go to the interpreter 10 days or 15 days ahead of time so that the interpreter can translate your report. So we're going to talk about that a little bit later. But that is all covered under FAPE, free and appropriate public education.
So, FAPE is defined under Rowley, and it was a court case that happened in 82 that identified what is the guaranteed responsibility of a public education setting. And to meet the standard, the district must answer the following questions in the affirmative. So, has the district complied with all the procedures set forth in the Act? And is the individualized education program developed through the Act's procedures responsibly calculated to enable that the child is receive an educational benefit? Meaning, what this all means is this document, did they follow the rules, and was it calculated in a manner that ensures the child is able to receive the educational benefits? An extreme example is if the child is deaf and hard of hearing and the child is not provided the correct interpreter services or whatever that child needs, that would be in a violation of FAPE.
And this next slide just really points out, and it's bolded there for you and underlined, in light of the child's unique circumstances. As you are working with the team members to draft the IEP, remember, this is the only legal document. It has to be legally defensible. So as you are working together to craft that IEP, you have to take into account the individual child, which is why it's called the individual educational plan. And so if an auditor from the state were to come in and see the same goal written, child after child after child, and one child was blind, one child was deaf, one child was hard of hearing, one child had a phonological disorder, but saw the same exactly written goal on each of these children, they might challenge that that did not take into consideration the unique circumstances of the child. The more complex the child is, the more collaboration that has to go into creating that. And on this next slide, we're going to look at some of those unique situations.
Yeah. So some of those unique considerations that we make on a daily basis when writing IEPs are cognitive abilities. And this isn't strictly a cognitive assessment provided by a psychiatrist or a psychologist. This could be the student needs extra wiggle time to focus, or some Velcro on their desk to help them focus. Simple things like that. It doesn't have to be extreme. Communication abilities. So they might be verbal, but their phonological delay could be so severe that they also require some sort of assistive tech to help them communicate within the classroom. You have emotional and mental health functioning. That is something that we are definitely becoming more aware of as things progress. And we do have social workers and counselors typically sitting on those teams that are helping us through what that student's individual emotional health or mental health challenges are. Behavioral regulations, and a lot of times the behavioral regulation can be written into a behavior intervention program, which is also called a BIP. You have motor functioning, so PTOT is the student wheelchair bound or require a Hoyer lift. And then for those medically fragile students, what is their health status and what are we looking at in terms of equipment, staffing, medications? That can also look at students who have ADHD. Do they take medication at school? Those are just some broad scopes.
And I also wanted to point out, Lene, that when we look at all of these things, one of the questions that often gets asked, especially if a student has missed a lot of sessions, is when do you schedule this child?
Oh,
If you know that they have a health issue and come late to school, they should not be scheduled first thing in the morning.
right. And that's something that we learn as we go, right? Like I had a student I had scheduled for 8 o'clock in the morning in August. She was late 3 weeks in a row. And I went, okay, you're moving. And she was placed at 2:40 in the afternoon because that's just how it was. I know I had a medically fragile student several years ago, and luckily I had a great relationship with mom. We worked on a week by week basis. And if the student was doing really well that week, we got all our minutes in for a 2-week period because the next week may not have been as well.
Mm-hmm. And that kind of leads us into another common question about missed sessions and the school code requirements. And we wanted to go back to the original source of where this question comes from. The school code makes the determination that the student's IEP team must determine that a certain service is required for that student to receive FAPE if that service cannot be implemented within 10 school days after that service was supposed to be initiated, as set forth by the IEP team during the IEP meeting, with the parents signing off that this IEP will start in 10 days. Then, if we can't provide that service, the district needs to provide that parent or guardian with written notification that the service has not yet been implemented. So when does this come into play for speech language pathologists? It comes into play when you reach that max of you may not service more than 60 students within your workload caseload. So if you were at 60, you finished the evaluation and no one has come off your workload caseload, then this would be a time where you notify your district representative, your director of special education, your building principal. If you don't have a director of special education, you're notifying an administrator that while you have found the child eligible, you cannot initiate the services at this time. And then that then will trigger someone within the school providing notification within 3 school days that at this time we cannot comply with the student's IEP. And then the district has to notify the parent or the guardian about procedures to request compensatory services. So it's very clear, if you trace everything back, that one missed session does not equal denial of FAPE. The IEP team must make that determination if a pattern of missed sessions are impacting FAPE and if compensatory services are appropriate. For instance, within the school setting where we know that we do have a shortage of speech language pathologists and assistants, there might be a time where someone becomes ill and must go on Family Medical Leave Act. It wasn't planned for. The therapist has to leave work for a period of 4 weeks, 6 weeks, maybe 8 weeks or 10 weeks. That's an unplanned event where now all of a sudden the services that were supposed to be happening are at a standstill. The district is searching. So they have to notify the parent. We are searching for someone to come in. An emergency has happened. We're going to be collecting some data. We're going to be asking some therapists or teachers, or we'll take your input and know if these missed sessions are now impacting your child's progress. But again, it's a team decision.
So when we're discussing compensatory services, again, that's not one missed session. That's a pattern of missed sessions that negatively impact that student's progress. And compensatory education remedy, which is expressly identified or defined in IDEA, which we just went over. Courts and administrative hearing officers have the authority to order such services by exercising their authority to grant such relief as the court determines appropriate. Now, I've never been through one of these hearings. Diane, do you know what is typical? Is there a typical like compensatory percentage that they do?
No, but if we want to advance to the next slide, we'll talk a little bit about some of the purposes, which might shed a little bit of light.
Okay.
Because the reason I wanted to advance is it's not meant to punish. Compensatory services is not a punishment upon a district. Okay. The purpose is to ensure that you're placing the student in a position that the student would be in had they been provided with those services in the first place. And so that's truly why there's not a uniform percentage out there.
Mm-hmm.
It just doesn't exist. It is on a unique student by student basis. And typically when you think about compensatory services, they're thought to be services above and beyond what's normally due the student, because here's your normal of what is supposed to be happening, and now we have to compensate you. Mm-hmm. So sometimes districts try to do the compensatory services if all of a sudden they've located a contract company perhaps, or some teletherapy that can come in and do some work. Once they identify that, they'll give the normal and then they'll start compensating on top of it. Others have to define periods of time. Some school districts are on year-round schedules. And so they're able to pick up a therapist to come in and work like an intercession, mm-hmm. Or an extended school year where they're able to help. Other districts might be in a position where they partner with a local business to provide some of these compensatory services. I know that that's happened in the Kankakee area, where they couldn't find a therapist, and so they subcontracted with someone working in another setting. Mm-hmm.
They did that in my district as well when I was on maternity leave.
Mm-hmm. And truly it's really a procedural error that typically only results in a denial of FAPE if the student was harmed by the error. Okay, again, they're not out to punish districts. That's not what they're in it for. They're in it to make sure that that student gets back on a level playing field. And that's why I go back to 1 or 2 missed sessions is not call for compensatory services. And so let's look at the next slide because it talks a little bit more about it. So these are some of those factors that those hearing officers are going to be looking at. They're going to look at how long was the service denied, but they also want to see that progress towards goals and benchmarks. Okay. They want to see progress on district and state assessments. They're also going to want to see academic, functional, and/or behavioral data. They're going to see if that data is demonstrating progress, because if the child was able to make progress despite that service not being able to be provided, there's less of a claim that compensatory services are needed. Mm-hmm. Some might be needed, but they may not be needed at the level that was initially thought. And sometimes it's a matter of the district will pay for out-of-pocket educational expenses. If a parent can prove that while my therapist wasn't here, I took them to private therapy, and it was that private therapy that got them this progress, then sometimes districts may deem that, or the hearing officer may deem that as appropriate to pay for that out-of-pocket expense.
All right, so I know everyone has seen the SMART format before, but we just want to reiterate that goals have to be specific, measurable, achievable, realistic, and timely. So we're going to go over that a little bit. Again, we're looking at goals that if I don't know this child, I can pick it up and work with them. That is our goal when we're writing goals. So timely, we typically look at the overall goal as being within that year. I like to write them as by the completion of this IEP period or IEP cycle. For the goals, the benchmarks are usually broken up per quarter. So I have something to measure per quarter. Not everybody does it that way. Realistic. So if you're working with a child who has significant phonological delay, your overall goal is not that they're going to be using every phoneme correctly within a year. That is not realistic. That is not the likelihood of that happening is not high. So you would pick a certain number of those phonemes or those phonological cycles that they are utilizing and focus on those specifically. Again, the realistic, the achievable, you're not going to have a severe phonological student having all their sounds in a year. So, measurable. So we like that 80%. That's something that was ingrained in us in college, but you can also measure with a rubric. I like to use rubrics, especially when I'm doing inclusion stuff or when I'm doing AAC communication. So effective communication or making sure that they're using their strategies in the classroom. I have rubrics, as well as fluency rubrics. They're great for that. And then specific, writing a really broad goal. You know, if you're writing a goal for all phonological sounds, the next person's not going to know that you were working on K and G, or working on backing. You might start with blends, and then you're not matching what the student was previously working on.
Okay. And one of the things that you need to keep in mind is that as you are calculating the IEP and the goals, you need to be planning for development and kind of working through a problem-solving method. So as you're creating their intervention plan, you should be able to describe the intervention or instruction that's going to take place, the frequency and the length of the time. So when you're writing their current level of performance, you can talk about, we worked on K and G for this amount of time, accuracy came up to. When we talk about the materials that were used, we want to be very careful here. We want to say working in a computerized program, working in a educationally published curriculum. You do not want to say that the child is going to master the vocabulary list listed in such and such textbook. Okay. Because if that child were to get up and move, that child now has to have access to that textbook that was being used in the other district.
That might not be relevant to their present education.
Right. And so you don't want to do that to a student where they're going to have a rewrite of their IEP. Also, likewise, you want to name the features of augmentative communication that are being utilized. You do not name the specific device that's being utilized, because if the child is working on a device and the device breaks, and the loaner device that you're getting or the alternative device you're using doesn't match up, you've named a specific name of device. That's what's required. So you really want to be more general and talk about the features. Think back to the set process. What features have to be here for the child? And you also may want to say utilizing total communication, which allows for the mixture of sign language, gesture, core vocabulary words, picture supports, picture exchange systems. You don't call it PECs, but you call it a picture exchange system. Okay. You also have to be able to describe how you're going to progress monitor. Okay. That's got to be there. You have to have a statement. And if you can't answer that question, you're not ready to present that at an IEP meeting. Because if an advocate is sitting in that meeting and you cannot exactly explain how you're going to progress monitor that, they will say that goal is null and void and you need a rewrite.
Mm-hmm. This is a little look of, this is a newer section of the IEPs. It's for parent training and counseling. And when we talk about the parent trainings, sometimes, well, a lot of the times, it is very important that we help these parents carry over these skills at home, because they're at home just as long as they're at school. So if you have a student working with an AAC device, or working on transferring, or working with some sort of like the shoes inserts, not my area of expertise, having the parent come in and learn how to use the system, how to use the shoe inserts, how to safely transfer the child, is huge. And so it is now in the IEP where you write under this parent training and counseling what specifically you plan on working with that parent on. I know some minor things I've done is bring the parent in and work on how I prompt the student, prompting and modeling and scaffolding, so they can carry that stuff over in the summer and on breaks. So it's not just the school doing it, and they're able to interact with their child a lot easier.
And so there's that section in the IEP now that talks about parent training and counseling. So anything you have to, that the parent needs, then you need to say yes. If there's nothing that a child needs their parent to assist them with, then it's okay to say no. Okay. One of the changes that occurred in this past year is Public Act 102-199, and that established a DCFS liaison appointed by the school board. So each of your individual school boards needs to have a primary contact for cases that involve the Division of Child and Family Services. This contact person is then charged with the responsibility of helping to assist in transportation coordination, because a child might be moved in the middle of a night. They might need some rides back to their serving school for a while until a more permanent location is found. And so this coordinator appointed by the school board is going to help with that. If a child's physically moving far enough away that they're no longer going to be in the same school that they were at or school district, ensuring that the records, once they are requested, are transferred out within 2 days. Where I work, we have a high number of students who are placed into our county from Chicago proper. And so those records have to get to us within 2 days, so that we can continue the work with the child who's been put into protective custody. The parent or guardian with the parental rights or educational surrogate and caseworker must be invited to all meetings. So the DCFS caseworker needs to receive all notices. So it's not just issuing them to the parent guardian, they also must go to the DCFS caseworker. And so the person appointed by your school district can assist in making sure that that information gets there.
This is a little piece of information. According to a survey conducted by the Illinois Association of Regional Superintendents of Schools, 34% of open SLP positions went unfilled or were filled by unqualified candidates in the 21-22 school year. I'm not sure what unqualified means, but that is a lot of openings, and that is a lot of districts with underserved students. And I do know when I have looked at the job bank, there are some districts that still put out that they want a type 74 or a type, it's been a
Type
while.
3, type 9, type 10.
Yeah.
Type
So
73. That
if
doesn't
you are
exist.
applying for jobs, don't let that deter you, because we don't utilize those numbers anymore, and it's possible they're putting up those job things and not remembering that we have switched out. It's so don't let that deter you. Still apply, even though you have a Pell and not a type 70 whatever. So
Now, if there is a shortage, there are some things that we need to do as SLPs. Certainly work towards completing workload analysis and work to balance your workloads within your district. Yes, that might include some people shifting positions. It's well within the right of your school district to request you to shift your position. You are hired to serve the students. Generally speaking, we have a saying that says, you have a contract to work with us, with our students, and the location of the students is the deciding factor of where your work will happen. Certainly work with your administrators to determine if it's appropriate for perhaps an SLPA to be hired to assist in your workload. Remember that SLPAs may not hold their own caseload. They are there to assist you. They are not case managers. Okay. Is it appropriate for some students to receive teletherapy services? Can your district contract with teletherapy providers? In certain situations, this has been extremely successful. There are teletherapy practices. We have a teletherapy practice committee within the ISHA organization who are monitoring this to ensure that it is used appropriately. Take a look at your negotiated contract. Are you allowed to be paid for additional hours beyond your normal workday? such as if you find that in order to meet the needs of the services, you're not getting any of your report writing done at work because you're actively working with the students. Is it allowable for you to be paid for additional hours after? Is it allowable for students to come in prior to the school day starting? You can certainly see if you can pair up with a local university to see if students have clinical hour needs that might be able to be supervised by university personnel. So a university supervisor coming in and supervising their student clinicals, perhaps short term, that might be appropriate. Absolutely, you need to ensure that those students who are ready for dismissal are actually dismissed. Again, we go back to your schedule at the beginning of the year should not be your schedule at the end of the year. Your schedule from year 1 to year 2 to year 3 shouldn't have the same student in the same block year after year. Take a look. Have they made enough progress? Is it time to be dismissed? Are there structures, accommodations that are still appropriate to be written into the IEP that could assist them, but they no longer need the actual support of the speech language pathologist?
So SOPA is the law which protects student data online. And when we're looking at making sure that student data is effectively protected, because we keep a lot of information online now, each individual district has a list of allowable programming. So for example, like Embrace therapy, Embrace IEP paperwork
is SOPA compliant.
And I use SLP Toolkit, but that is not SOPA compliant for all districts. So my district allows it. I don't know if all districts do. So it is important that when you are looking at using an online data collection or student information keeping device, talk to your tech people and whoever is in charge of that list so they can check it for you or have it added if it does comply with their standards.
And there is an agreement that must be signed. So if you're wondering why there are some tools that you might have used in the past that your district no longer uses, the bottom line is that the creator of that tool is not willing to sign off to say it's SOPA compliant. If they won't sign off on it, your district cannot allow you to utilize it. And certainly different districts have different standards. And this is just more information. There is a privacy officer who must ensure compliance. You must have subcontractors listed. There's a whole bunch of information that those companies have to follow. And if they're not willing to follow it, your district can no longer enter into agreement with them for you to be allowed to utilize it. So what does that mean? You must communicate with your district regarding any online tool you wish to use. Do not use a tool that collects personal information about a student if it is not SOPA compliant.
All right, so Medicaid billing in schools. A lot of school districts do require Medicaid billing. And that is an individual student or individual school district thing. Talk to your school district to determine what they require in terms of billing. Now, to be able to bill each student, you have to have a referral signed by a SLP or person of the healing arts, I believe is the direct quote, that is not providing the direct service. For example, I cannot sign my referrals.
It's best practice not to sign your own referral.
Yeah, it doesn't specifically say that, but it's frowned on. So we have someone in the district that does that. The referring practitioner, so the person signing that, has an impact number and an NPI number. I'm sorry, an NPI number and is registered in impact. The notes of the session must be signed on each page or uploaded into your district's third-party billing system. So again, we use the Embrace billing system. We upload that information. We don't have to sign it, but it is uploaded to there. If you do not use like an online system, it has to be signed on each page. And they are retained for 7 years. In addition to our online system keeping them, I like to print copies at the end of every school year and keep mine for 7 years, just in case we switch billing systems. It's there. And then just so you know, there's some additions to the Medicaid conversations and some potential changes. We used to have 18 months to bill for a service. Now they're talking about, as of July, having 6 months. And just keep an eye out for that. It's not official yet, but it's likely.
And we just have a few more things that we want to remind you about. Workload analysis. Each district is required to have a workload document on file with ISBE. JCAR is now looking into the matter of if school districts are actually following workload analysis. So you can anticipate future conversations, and Karen Cockler and I have worked on updating the workload analysis and eligibility documents, and those are on ISHA website for your use.
This is transition from early intervention to school settings. My district, we have a early childhood program, so we do receive students from our early intervention area. And if they are aging out of early intervention, meaning they're turning 3 between May 1st and August 31st, you have to finish that evaluation before the end of school, because they are eligible to receive services after turning 3 before the start of school. So anyone who turned 3 between May and August, I've already completed their EI transition meetings, and they're ready to go to receive summer services. And that is new as of last spring.
Yes. And it really goes into child find. We have to make sure we're doing our part to ensure that children who may have a disability are identified early in their life and receive the needed services.
So here's the translation requirements. The 10 most commonly used languages spoken in America. Is that list on a website somewhere?
On the ISBE website.
On the ISBE website. All right. All translations must be performed by a competent translator who has undergone training. Is there requirements on what a competent translator who has undergone training is?
Listed on the website.
Awesome. Okay. If the district utilizes an automated translation program, the results must be reviewed and or edited by an individual qualified to determine the accuracy of the translation. Also listed on the website?
Yes.
Okay. So this also includes translation services for the meeting, correct?
Yes.
Okay.
So a competent translator needs to be at the IEP meeting.
Does ISBE have a list or a service as to where we can acquire a person who is a translator for these languages? Because some areas like mine, we don't have a lot of translating services.
So there are some national translating services that have been utilized by some different districts. And so I know that while there may not be a specific list on a website because things change, there are search engines that can help you identify. And if your district is struggling, they should contact ISBE to see what other districts have been able to come up with.
Okay. And here's a list of all the things that must be presented to the parents in their native language.
Correct. And we just wanted to touch on the impact of Title IX. This has been a large topic, and it does certainly impact the fields of speech pathology and audiology, especially if we are working with adolescents who might start to be expressing some gender identity and transgender rights. And just be mindful of that. You are required to support them and move forward in ensuring that they are not being discriminated or harassed. And so, as an advocate for students, that falls within the privy of our profession. And likewise, Lene talked a little bit about trauma. Okay, SLPs certainly play a role in supporting students who are going through trauma as part of the multidisciplinary team.
Here's an overview of the MTSS framework. Most of you should be familiar with RTI or MTSS. It's kind of transition names, but it should be very similar in style in terms of the tiers. And we are part of that team.
And we just want to say thank you for being advocates for our students. Lene and I, again, are the co-chairs of the School Affairs Committee. We work on answering emails that are submitted to the ISHA website, and we contribute to the ISHA newsletter. And we work on multidisciplinary teams on a regular basis.
And we also present at ISHA every year. And we welcome new members to our committee all the time and would love to have people who enjoy writing things for the newsletter.
All right. So thank you so very much for joining us for our presentation. And if you have questions, that final slide gives us our contact information.
All right.